when someone is going through a tough time in their life, to have your boss be able to not just understand that when you talk about it, but even to see that, or maybe even recognize that you're going through a crisis before you recognize you're going through a crisis, is extremely valuable and helps create a workplace that is healthy and welcoming to everybody, no matter what you're going through.
There's no question that there's a stigma sometimes associated with persons who suffer, sometimes in silence with mental illness. And we want to have the type of counter and employ where we can reduce that, where it is okay to get help if you're feeling a certain way.
When mental health first aid is available and is almost at somebody's fingertips and they can reach for it as if they're reaching for a notebook and a piece of paper, then we begin to make our spaces a little more comfortable for people to just exist. And we want to do that as a county because we want more employee engagement. We want to reduce absenteeism at work. We want to reduce stress and anxiety at work because you spend so much time at work. And so you want it to be a pleasant experience.
By doing this training, it creates the opportunity for us to sometimes resharpen our salt because we forget about those things that we have been trained on, and it gives us the time to refocus our efforts. And so because of all of that, we have seen an increase in the number of employees who are taking advantage of our employee assistance programs, where they are voluntarily going to get help, where the referrals have gone up. That helps us to stabilize the work environment.
Mental health is actually very personal to me, and I imagine it's very personal to a lot of people. I have a son, I have 4 sons, and one of my sons was diagnosed as bipolar schizophrenic, and it was quite a journey getting him the help that he needed. But the bigger journey was being able to talk openly about the challenges that we faced as a family and the challenges that he faced as a person. And I found that the mental health first aid put us all on the same level playing field, and we could talk openly about those challenges that almost every family has.
What I hope happens as a result of this mental health first aid program is that employees will feel free enough and liberated enough to actually ask for a mental health day off. And I've needed a mental health day off in my past work, and I think it's something that everybody needs.
Where if you can call in sick because you have a cold, you have a fever, you have some other ailments, we want you to be able to feel just as comfortable calling in to say, I need a mental health well-being day off today. We want that to become the standard, where our employees are not embarrassed by it, but it is a culture within our organization that is accepting of that.
We want to make sure that everyone has strong mental health and well-being so that, when they come to work, they can give all of their customers, all of their clients, all of our constituents their very best. And in order for them to give their best, we have to make sure that they have these tools.